So welcome everyone to MA 21 Alliance meeting. You can see on the screen what our agenda is going to cover. Welcome and background, self-direction regulations, the PDP toolbox that was published by DDS just recently. We have independent facilitator versus personal agent. And we'll go on to talk about flex funding, and then we'll stop the recording once we get into the dialogue. So let's, okay, I'm not going to worry about the waiting room. I see someone's covering that, so that's great. So who is MA 21? Many of you who are present today have attended our meetings in the past, but we always have new folks, so welcome. And just a quick overview of who MA 21 is. The Massachusetts Alliance for 21st Century Disability Policy was formed actually in 2007. Our main goal has been to protect the right of people with disabilities to self-direct, and through its efforts, help pass the Real Lives Law in 2014. We were definitely not alone. A lot of folks and other organizations definitely helped with that. MA 21 is a partnership of self-advocates, family members, and other stakeholders and disability advocacy organizations. You can see they are noted right there on the slide. So what is self-direction? Self-direction is not new. You know, I like to refer to self-direction as self-determination. It's through the self-direction service models that folks can really take their vision and be in control of how their services are utilized. So self-direction, these three bullet points, once you view some of our documents, such as the fact sheet, you will see this is taken from the fact sheet. Self-direction lets you choose your own services so you can live the life that you want. When you self-direct, you have the flexibility to choose the right supports for you, the staff you want to work with, and a schedule that works best for you. And this means that you would hire and purchase and manage services and supports with help from Mass Department of Developmental Services, known as DDS, your family, and others who are involved in your life. So the MA 21 website, here on this page, where we actually just wanted to point out, when you go to the MA 21 website, you have the option to download the fact sheet, to register for meetings, and we like to put communications out periodically. So you want to go ahead, if you're not already signed up, click on under the Join Our Efforts subscribe, and also take action. And the take action, we'll cover that in a little bit. So just again, wanted to introduce the website to everyone. And when you go to the website, you'll see, again, the member organizations where you can click on. And then we have also awesome, my personal opinion, awesome resources and reference materials. And this is where, Ed, I believe you, we're going to have you click on to the website.
Yep, this is the website right here. The one thing I really want to point out, because it tends to get hidden, is the MA 21 document library down here. That's probably the most dynamic part of this website or resource on here. And I'll go ahead and open that up. This started off as we got a Google Drive, and things that we would find, whether it was Robert or Diane or Leo, myself, whatever, and a few others, we'd start throwing up to a Google Drive as a resource. And we ended up creating this Google document just as kind of an index of some of the things that are out there. If you do frequent it often, there's also a what's new page, so it's kind of easy. Try to make it an easy reference for what's changed on here. So we'll dive into a few more things on here later. But again, on the website, the document library is, I think, a really good resource right here. And I think that puts Robert up.
Okay. This is Robert Beckett. For many of you who have participated in previous meetings going back a year and 4 months now, probably had 5 or 6 of these large group meetings, you'll know kind of the situation on the regulations. But the real life law was passed in 2014, and the law provided developmental disabilities would issue regulations, and they have not yet issued regulations. The first attempt that they did to issue regulations, which are intended to implement and enforce the law, was October of 2022, and those regulations drew many written and verbal comments from the community, and as a result of those comments, those proposed regulations issued on October were withdrawn. And then we've been on a journey now since November. That was when the public hearing was of 2022. So December of 22 through now March of 2024, we've been through the journey of getting revised proposed regulations. The Department of Developmental Disabilities probably spent 7-8 months in 2023 attempting to develop them. They were ultimately then sent to the above DDS, to the Executive Office of Health and Human Services, EOHHS, and they reviewed them for probably 4 or 5 months. And finally, we did determine, or in February, the proposed revised regulations left EOHHS, and this, at the last Self-Determination Advisory Board meeting, Jane Ryder indicated that the proposed revised regulations were now with the Executive Office of Finance and
Admin and Finance, I think they called it.
Yeah, administration or finance and administration. So, and that the deadline for that office to get them out the door, at least back to DDS, is about coming due. So we still expect these regs to come very shortly, and but then we've been waiting for them for, if you look back to 2014, we've been waiting now 10 years. If you just look at from 2022, a year and 3 months. So once those drop, we're ready to go. We're going to get the regs out to everybody on this list and all the people that have registered, and we're going to try to help people, let them know when the public hearing is, and we're going to try to help them develop ideas so that they can make their own comments verbally or written. And that's what I have.
Hey, Robert, maybe there, I don't know if anybody has questions on that topic about being ready. It's been a waiting game for us for a while, but if there were any quick questions about that, maybe not. Okay, good. All right, so we're going to spend most of our planned time today just talking a little bit about the participant-directed program, the PDP Toolbox. I don't know how many of you have been sitting on the edge of your seat waiting for this thing, but I think it's been about 2 years that I've heard it was coming. So I was glad to finally see it on the DDS website. Sorry, I got a bit of a head cold today. I'm actually going to, instead of making you read all of this, I'm just going to navigate through the website. And by the way, this whole PowerPoint is posted in our document library. So if you want to go back and get this, that's your incentive to go find the document library. And if you can't do that, you can email us at the MA21 email address on the website. So this is the navigation. In order to find this thing, you go to DDS Self-Directed Services. and scroll down a bit to getting started in participant-directed programs. So I do want to say one thing there. When we talk about self-direction relative to DDS, there's two distinct programs, right? One is the PDP, or participant-directed program. The other is agency with choice that you see over here. So there are two different things with a little bit different set of rules, but just want to make sure people aren't thinking that when we're talking about PDP, that's the sum total of self-directed services. There is the other option as well. So you click here, and then on the Getting Started page, it is a long scroll down. But if you're persistent and you keep going, you'll eventually on the bottom here find the Participant Directed Services Toolbox that was just published, and there she blows. I'm guessing there might be one or two people on this call that might have been involved in the development of this thing over the years. I know they had some families involved in reviewing it as well. So if you were involved, thank you for your efforts. So I'm going to close these, and
Ed, there's a question on the chat from Jennifer. Do you see it about highlighting the difference between the two, PDP and AWC?
Sure. I guess I'll give it a shot. PDP has a little bit more variety of services that you can use through self-direction. And it's a direct service where you're a little bit more independent in administering your own program, and you use PPL as a fiscal intermediary to actually handle the timesheets and making the paychecks and whatnot to your employees. On the AWC side, the agency with choice side, there is an agency involved. It's known as a co-employment model, where the agency is technically the employer of record, as opposed to the individual that's doing the self-direction. And there's a much narrower, I think there's two service codes, individualized day supports, which is out in the community, individual home supports, which is skills at home, and then some flex funding. So you're pretty much limited to those three services. You'll see a little later on, I'll pull something up that'll show you what's available under the PDP program. Diane, you're involved on the AWC side. I don't know if you want to pipe in on that at all.
And I apologize, I was responding to a message in regard to
Just the difference between PDP and AWC. Hopefully I covered it satisfactorily.
Oh, no, you definitely covered it. I mean, I keep reading DDS states that with PDP, there's more flexibility. I mean, agency with choice has worked well for my son. And I refer to the law. I'm kind of stumbling with my words because I'm about to share my opinion, and I believe that self-direction is self-direction, and the real lives law does not indicate, it's under this model, you get this, under this model, you get that. It's just that there's more information about PDP and less information about agency with choice. So that's my comment.
Okay, thank you. So relative to the toolbox, there were two topics that we just wanted to cover on that, and I've got a few slides on this. One is the independent facilitator topic, which comes at us from a few directions, including the real lives law. And then the second one will be flex funding, which I'm hoping will provide some really useful insight to some of you guys if you are doing PDP right now. So on to the next slide. Robert, I think you were going to talk through this one, the independent facilitator, in terms of the language from the real lives law.
Sure. This is one of the three provisions in the real lives law that specifically requires the department to issue regulations. And so if we just read it, I think it's good to read it. Independent facilitator under the real lives law is defined as a person selected and directed by the participant to assist in the development and execution of a person-centered plan and to assist the participating in making informed decisions about the participant's choices regarding self-determination, including but not limited to the short and long-term planning goals for self-determination and the transition to self-determination, provided that an independent facilitator shall meet minimum qualifications established by the department through regulation prior to assisting a participant. And provided further that an independent facilitator shall not provide any services, supports, or goods to the participant under the participant's individual support plan and shall not be employed by a person providing services, supports, or goods to the participant. So 3 components of this definition. What's the role? That minimum qualifications must be set by regulation prior to assisting a participant, and that the independent facilitator is truly independent. As a result of the department failing to issue regulations, now 10 years, there has not been the opportunity for anyone in participant-directed or agency with choice to retain an independent facilitator because there are no minimum qualifications that have been established.
When I first read this in the real lives law, you know, I kind of thought about this in a couple of different ways. One is kind of a navigator, you know, as somebody's entering the DDS world and trying to figure out what services they want and what direction they want to go, that maybe the independent facilitator provides some guidance independent of where DDS may guide somebody. The other thing that it struck a similarity to for me a little bit was also educational advocates in the school system, right? Not an attorney, sometimes just another parent, but somebody with more knowledge, some training that sits on the same side of the table as the individual or the family. So that's kind of what I took out of independent facilitator when I saw it in the real lives law. This here is the description that's under staffing supports in the PDP toolbox. It talks more about the independent facilitator service assisting people to manage their self-directed services. Might help the participant or the employer of record to understand the employer role, develop circle supports, identify community resources, recruit potential staff, assist in creating a schedule. And then it talks about that role being in addition to the supports the person already has, including the DDS support broker. And just qualifying that with the fact that independent facilitator cannot technically supervise staff or approve timesheets. Sorry. And I'm not saying this is right or wrong or anything. I'm just, you know, sharing what was in the law, sharing what is in the toolbox. And to me, as I read the toolbox, this seems like a little bit more like somebody helping, it actually says it here, right? Helping to manage the self-directed services, being more of an admin type assistant, maybe even some training of the individual. And the last clause in here that this displays as private support broker in the portal, I think they're a little quick on the draw on that because I don't think this is set up and available yet as a service to be assigned to people. So that might be what they're anticipating doing. And I'm a little confused about why when the law refers to independent facilitator and the PDP toolbox refers to independent facilitator, why they would apply a totally different name to it by the time you got to the portal.
Ed, Cindy excuse me, Ed, Cindy has a question, and I'm not sure if you, from that information, if you know of where the funds come from.
So that's sort of and this slide actually, the thing on the bottom, right, is having access to these services, and we'll also talk about personal agent. These services as an option does not automatically mean a larger funding allocation to pay them. Okay, so there's two different things. One is whether you can use your PDP funds or AWC funds to pay an independent facilitator or personal agent. The second question is, do you get more money because you have those things? And again, without the regulations and whatnot, I'd be guessing on some of these things. So I hesitate to do that. What I can say is that the personal agent that we start talking about here is a service. It's a longstanding service that's available under PDP. And I can actually bring this code sheet up in a moment. I think there's something like 15 people in the state that are enrolled in that service, and maybe only 10 actively using it. It's currently very individualized, usually on an ongoing basis, providing a lot of support. Maybe in some cases where people don't have, families to provide support that families might otherwise provide. So some of this knowledge that I'm sharing, and again, as opposed to knowledge, I should probably call it hearsay, because it's things I've heard and I'm relaying, but it's from sitting in on the Self-Determination Advisory Board, the SDAB meetings. And then SDAB actually has a work group that has been working through discussion of these two roles for, I think, at least like the last 6 months. So I don't know how fast it's going to move beyond that. But a lot of the discussion has been about whether these two roles get merged together. And frankly, I struggled with that for a long time, and I think I'm finally getting okay with it, as long as it doesn't get in the way of the role being effective in whatever it's going to be. You wouldn't want, the personal agent role that's already out there, if all of a sudden independent facilitators have got a hurdle to get over relative to training or certification. You wouldn't want to negatively impact, a role that's been working. Cindy, I don't know if I answered your question at all to the best I could.
Right. So Ed, if I could just 19I of the Real Lives Law, I believe covers the issue that Cindy has asked. And what it says is that an individual budget shall not be increased to cover the cost of an independent facilitator, except as provided by the department through regulation. So when the department issues regulation that provides for minimum of qualifications, they can also address 19I. But in the regulations that were proposed in October of 2022, they did not issue anything about independent facilitators. So this particular issue could not be raised, other than they simply didn't raise it. So I think that I is saying that unless the department by regulation provides something else, in other words, provides that the independent facilitator is above the budget amount, then an individual budget shall not be increased to cover the independent facilitator cost.
So
another reason to be looking for the regulations.
Yep. Which again, I would be dumbfounded if there's much about independent facilitator in the pending set of regulations, given the level of discussion it's still at in SDAB and the SDAB work group. I can't imagine how there's going to be anything meaningful in the pending regulations.
Okay, and if that's true, then it'll be a continuation of the of DDS not allowing and not giving people the right to retain an independent facilitator, regardless of the funding of it.
Now, remember one other thing, which is that the Real Lives Law, the benchmark for the funding that you should get in self-direction is an equivalent budget to traditional services. So to the extent that you can make a case that you need a really high budget in traditional services, that might provide an avenue to have more money to pay for this and other services.
Right.
One place I wanted to go here, and again, this is out on the library. This is the PDP service and code matrix. I want to pull this up and spend a minute or two on it, which I think will also be helpful when we hit the next topic. This document is not part of the participant directed toolbox. I wish it was, because boy, this has a lot of information in a very condensed fashion. Actually, let me scroll out a bit first. This is supposed to be, it may not be totally all inclusive, but it's supposed to include all of the service codes that are available in the PDP program. Actually, I can think of one that's missing already, but it's divided into waiver codes. Okay, so the top half, the green, are the good codes, because state of Massachusetts gets half of what it spends back from the feds for individuals who are on Medicaid and the waiver. And then the bottom of this is non-waiver codes, which Massachusetts is a little bit unique here, that we dig into our own pockets, and we do provide some funding above and beyond what the federal government will cost share on. So this sheet, you know, the most common things that are on here, for example, the individualized day support. Okay, tells you what the code is. That's what you would see in the portal, the PPL portal, if you've got that service assigned to you. It tells you over here that there are no rate caps for individualized day supports. Now, if you want to pay somebody $100 an hour, you might still get some pushback, but there are no official rate caps. Individualized home supports, which is, you know, in the home, does have a rate cap, but it's a fairly generous one for most people, probably. Again, you guys can find this document in the library, so you don't have to worry about reading it all right now. But next one is, and we'll talk about this more on the next couple slides, is individualized goods and services, which it says here as listed, $3,000 annual cap. And then there is something down below here called flexible funding, which is non-waiver and has a $5,000 per year. I don't know if you can see what I'm highlighting here. It's kind of weird the way they laid this out, because the Educational and Training Institute is not part of the $5,000 cap. So I don't know why they didn't follow the same format as up top. So, and here's the personal agent code. That's kind of an exception to the employer model, where they're referring to an independent contractor here. And then there's something down here called financial assistance, which is not used very often, but this would be for an individual who, you know, has no other resources to, you know, pay for some food or from rent or utilities. And you can see there's some time constraints on how long that could be utilized. So I'm hoping there's some wide eyes in this group, anxious to find our document library and pull this sheet out. You will not find this anywhere else on the web. And DDS does know that I have it, because I asked them if there was an updated version, and they said this is the most current version. Any questions on this?
Curious on the flex fund and the education piece. Is it two separate budgets, or is it just one?
So that's a really good question, and I'm going to actually wait till I get to my next slide or two here, because I think that'll help answer it better. All right, so this is another page out of the PDP toolbox. It's a portion of the page. And my next slide zooms in more on this colorful area, so don't worry about squinting too hard to read that yet. But in the toolbox, there's a whole section labeled Flex Funding and Financial Assistance. Within that section, there's a label on this graphic that talks about Flex Funding Code Breakdown, There's the individualized goods and services that I showed you in the green section of that table. And there's the flex funding and financial assistance that was down below in the, I think it was a salmon color. Okay, whoops. And then it says, please note that these are the breakdown for the 3 most commonly used non-staff support codes. For a full list of non-staff support codes, please see the next page. So, very sorry. Hopefully I'm getting better. And it's not COVID, that's the good news. So, flex funding, as you can really see here, is a term that's thrown around very loosely. Flex funding is used as a big umbrella term over this whole group of codes. It's also used in the context of this specific code. And then, just to make it even more confusing, if you're in traditional services, I'm down in my bottom left-hand corner here now. If you're in traditional services, you may also get some support through a family support center. The local ARC, or I don't know, some other organizations may be the local family support centers. They can provide flex funding to individuals who are doing traditional services to buy some other things outside of the traditional piece of the services. If you are doing PDP or agency with choice, your funding under those programs is your funding. You are not going to be able to go get more flex funding through the Family Support Center. You might have gotten some of it before you were 22, but if you turn 22 and you do self-direction, whatever flex funding you get is as part of your overall budget. And then Agency with Choice also has some flex funding there, which I think is comparable to the orange one, the flex funding here as a non-waiver code. So here's my next slide that gets into it a bit more, but any questions at a high level here, and then I'll come back to the question about budgets and money on the next slide. We good? So I just zoomed this in a little bit so that you can see it better. Again, this is in that participant, the PDP toolkit, so you can go look at it there and kill a few trees and print it out and whatnot. But there is, under the individual's goods and services, there's a $3,000 annual cap on that service. And it's a waiver, they call it a waiver cap, so no exceptions to exceed that cap are available. I've heard sound bites from various people in DDS, from a service coordinator on up, over the last, I don't know, at least 6 months. Oh, we increased the cap on flex funding. And it was confusing as heck to me because I always thought this individualized goods and services was flex funding. Well, it's part of flex funding, but this is flex funding. So when somebody talks about flex funding from DDS, you got to be really specific about what they're talking about. And this non-waiver state money only is what they increased from, I think, a $3,000 cap to a $5,000 cap. So between these two, you can have $8,000 of, using the broad umbrella term, flex funding, but it's $3,000 of individual goods and services and $5,000 of flex funding. Now, you can, this $5,000 annual cap, you can go to the area director and make a case for needing more than that. They do make some exceptions to increase that further. The individualized goods and services, just an interesting tidbit. I've always heard that blamed on the waiver, that we can't go over that because that's a waiver cap, which to me always implied that CMS, the Center for Medicare, Medicaid Services, where the waivers are gone, that there was just a nationwide cap of $3,000 on that. It's not. That's a state-imposed decision to cap that at $3,000. If they want to change it, they have to go back and amend the waiver, but that's not hard to do.
And you have a question
Let me make sure. Who had asked the question about the money before and whether it was different? Was that Francesco, you?
Yep, that was me.
Did I answer it for you?
Yeah, I just was confused because it's two different numbers. I know it was just like separate at one point.
It hurts your brain a little bit, doesn't it?
Yep. They make
Well,
it look so simple when it's not.
yeah. Hopefully this helps clarify some of that. I'm sorry, Diane, you said there was a question. I don't know if that's a chat or a hand raised.
Go ahead, Debbie.
Yes, Ed, we have a couple in the chat. We have one from Danny who has some questions about finding personal agents, and is there a resource that they can find to use to find the facilitators or to sign up and be visible on, and how do people submit using the service code?
Okay, so personal agent, there is no standard established resource repository, whatever, to go find these people. So again, there's only like 10 in the whole state, and it's not a new program. So there've been very unique situations where they've used it before, and some of them have had it a long time. So it's really just like individualized day supports or home supports. Right now, it's up to you to find that person, and I would start by talking with DDS about your need and make sure that they will approve the personal agent for you. On the independent facilitator side, you know, that's the whole reason why the lack of regulations and whatnot are problematic, because there is no overall infrastructure for doing that. There are states, I think California might be one, there are other states who, you know, have a fairly robust process of not only training independent people to play some of those roles, but actually providing a registry where you can go find some. Just like I think there are for educational advocates. You know, there's some resources where you can go find those people.
We also have another question from Elisa Jennings about if you have any information regarding hiring independent contractors as an employee under self-direction.
Good luck. That is one of the things, if you look at the fact sheet from MA 21, you know, there's like 5 things that we're looking for. One is just general, you know, access to self-direction, right? That should be table stakes. The other extreme is the regulations that we need to support things, not to restrict things. The 3 things in the middle are the whole funding allocation process, the independent facilitator, and then something we call budget authority. And budget authority is being able to do more than just hire employees. You know, budget authority starts with having some control over how much you pay your employees, but broad budget authority would give you flexibility to obtain some of these services, maybe not only through individual contractors, but even organizations that are trying to provide services. So I good luck right now in trying to make independent contractor work other than possibly within the constraints of individualized goods and services and flex funding. Within that constraint, you might get away with it, but not under some of the other service codes.
Hey, Ed, it's Leo. I just want to ask you a direct question. You mentioned you found 10 across the state that are personal agents. Is that someone, because it's important for people? Yeah, go ahead.
That's what Ed Wilson had reported at SDAB.
All right, well, at SDAB, so, okay, you heard, okay, your ears might be better than mine, because what I was going to say is I didn't hear a number, right? And the implication was it's people know about it, just so people understand when they go to do it, that they may need to be advocating a little bit. Or maybe they got the message on the ground that it's that, no, please don't give people a hard time if they ask for this, because that meeting, I think if you convey to people, I think your ears are working better than mine from that meeting. I definitely got the perception that people wanted us to assume that it had been open all along.
Some of it,
yeah. Is that fair?
Some of it was in the work group meetings as well. It was a lot more explicit when they first reported that there. That
Okay.
it was around
Okay.
50 total, and about 10 actually doing it. And I'm rounding those numbers. It might have been 11 or
Yeah,
9.
somebody else implied it was 25. But the point is, what we were trying to get at the big meeting was that no, it hasn't been promoted.
Yep.
People don't know about it. So I think, Ed, if you agree with that, I think it's good for people to know that they might have to use some extra elbow grease.
My,
Um,
my advice to you is, for example, I'm going to pull it back up again. This matrix, use this as a tool to educate yourself. I wouldn't walk into your service coordinator, slap it in front of them with a red circle around personal agent service. I want one of these, right? Use the information, have the information going in, but I would not take the approach of sharing this directly back with your support broker.
The
And-
other issue, Ed, is the difference, as you mentioned early in the meeting, between AWC and PDP. Unless you heard something different in the smaller group meetings, my concern would be, despite the open discussion at the large meeting recently, that people in AWC, like Cindy and others, may get pushed back. I don't think they should get pushed back because it's in the law to have an independent facilitator for everybody. So that would require extra effort because,
I think you would have a challenge right now getting a personal agent within the AWC framework. But I would hope that they would make room for independent facilitator, as I envision it anyway, type services, navigator type services. Frankly, the SDAB's sub work group, Leo, they went as far, and I thought they had some real vision in this. They went as far as saying we should really make this independent facilitator, this navigator role, available before people turn 22. This role, you've got your transition coordinator, you got your, you got all those people, but again, they're on the other side of the fence, so they threw out some ideas of trying to fund as part of the family support stuff, maybe 10 hours of independent facilitator work to, help people talk through their options. And that's, again, not after you've decided to do self-direction or PDP, taking a step further back up and using the term self-determination, trying to decide what's right for an individual. Is it traditional services? Is it PDP? Is it AWC? So I was excited when I heard him talking about that. I don't know what'll come of it, but. So another thing for anybody that's already on PDP and might have, again, not many people have this financial assistance code because that's the emergency, keep a roof over the head, keep, food in the fridge. But probably a decent number of us have one or both of these, 5728 and 5300. Heads up over here, this red text. When you log on to the PPL portal and you see code 5300, the label next to it is not going to be flex funding. The label next to it's going to be non-waiver financial service, which doesn't mean a lot to me. I've been whispering and shouting in some ears, hoping that they might be able to get that changed to line up with the PDP toolkit that they've released. And then the 5400 is non-waiver financial. So it's non-waiver financial service and non-waiver financial. And you will not see these terms used anywhere in the toolkit or the toolbox, but those are the terms that you'll see when you log in to, see how your son or daughter or yourself is doing in terms of expending your money.
Excuse me, Ed, we do have another question in the chat about, do you know information regarding flex funding for those in agency with choice? About being able to get that into their budget?
I believe again, the three, let me go here. I think the three services, besides there's like 2 codes that pertain to the money that the agency takes from you. But in terms of the actual direct services you get, I think the 2 that are available from AWC are individualized day supports and individual home supports, but they use different numbers for the codes. And then I think the one code they have for flex funding is equivalent to, it's a different number, but I think it's equivalent to the 5,300 being a non-waiver and not individualized goods and services, which is a waiver. I don't know if that helps or not, but I think that's one of the key differences. I mean, you know, most people that are doing PDP, frankly, are probably doing individualized day supports, individualized home supports, and then flex funding and goods and services. My son happens to be doing education training institutes as well, because he goes up to 3L Place for 2 days a week, and that's how that one is funded.
So I just want to know that I'm familiar with at least one case, and I assume that it would be broader than that, where agency with choice and then the budget or the funding allocation and the budget allowed consisted of the agency services that were the codes and that the waiver codes, and consisted of, separate from those, consisted of a flex funding amount.
Yep, that's what I just said. That's consistent with what I said.
So I just wanted to be clear that it appears to be, based on what I've seen, that yes, agency with choice has flexible funding opportunity within it. Mm-hmm.
So
And we also have a question, I'm sorry, from Lori Medeiros. She's had her hand up for a little while, so.
Lori, go for it.
Yes, real quick, on this slide specifically, the blue section and the orange section, so we're talking 3,000 annual cap and 5,000 annual cap?
Yep.
Is it in total? So it potentially could be 8,000?
Yes.
Even though they're separate categories?
Yes.
Okay, thank you.
And this 5,000, if you can make a case for an exception, can be increased higher than that.
Okay, thank you.
Okay, exception to exceed cap based on need and funding availability. And again, this is all, if your budget is $25,000, this is all part of your $25,000. So if you might use all your $25,000 for individualized day supports, in which case you're not going to have any of this. Or if you're using these, it'll eat up some of your budget and you'll have less available for the other services. I'm going to go down one more rabbit hole, unless there's burning questions at the moment.
We have one more question from Lisa Jennings about what is the best way to comment about service with PPL.
Can you clarify the question?
Not sure if Lisa's.
Are you not happy with PPL?
June, that question is for you. Or was that June or Lisa?
Lisa.
I'm sorry, Lisa.
Hi, sorry. I'll ask the question. I was asking about PPL because I've found a number of process things that just don't seem consistent with good business practices. Even just they changed their email address last year and all of their documents still have the old stuff on it. How hard is that to change? It's really hard to hire a new employee when people don't understand the process.
Hey, Lisa, I would
yeah.
love to have a one-to-one conversation with you on that, because I was at there's a company or an organization called Applied Self-Direction, and they had their national self-direction conference down in Baltimore last week. I think that's where I got my head cold. and I bent the ear of the PPL folks. I mean, honestly, in general, I'm really happy with how that all goes in general. It scares me that DDS has put that out for bid, and I hope they don't change it right now, because they got other things to tackle. Even if it's not perfect, they got other things to tackle than going through a whole change of FI.
Okay, yeah, let's talk about it sometime. Love to.
Lisa, you want to jot down my phone number?
Yep, I'll take it. Can do it all.
Anybody else can jot it down.
I'll send you a message.
Okay, Ed,
Yeah.
Ed, why don't you give the phone number through chat? Or
Okay.
during open dialogue.
I'll do that. I'll do that after I want to get done with this, and then we'll move on, and I'll do it there. So the other thing I want to mention here, and this is a little bit harder maybe to grasp, But the waiver we talk about is a home and community-based services waiver, right? HCBS, which means that the waivers are about providing services in the home and in the community instead of institutions. I don't know how many years ago, but it might have been a decade ago now. 2 decades ago, there was the whole Olmsted thing. Maybe a decade ago was the start of the community settings rule. And Leo, that just finalized when, community settings? A couple of years ago?
Yes, and it was delayed, for a while as under Trump, and it was
Okay.
just turns out activated. But
So,
it's not particularly rigorous, but there is a community settings rule. Yeah.
so the community settings rule, I think, is what shut down sheltered workshops. It's
Yeah. It's also related to with larger settings for residential, especially, any segregated site, like you said, that does not allow for inclusion. So rehabilitation sort of falls in that ballpark, but it's a health related program, and people that do it part-time, I think it's less at risk. But in terms of, our goal obviously is to help people grow in real life settings,
so
right?
this might make your head hurt a little bit, but individualized goods and services is part of the waiver. So it is subject to, it's a home and community-based settings, whatever. It's subject to the settings rule. Flex funding is state money only, so less restrictions by the feds. The way, and this could change, but the way they are currently, the pendulum is swinging a little bit, and we heard this in New York State too. The pendulum is swinging where, for example, I can use individualized goods and services for anything that is wide open to the general public, is mainstream stuff. So membership to the YMCA, I can do with 5728. Our YMCA has something called their integration program, which is their special needs program that is not terribly integrated. So even though it's advertised to let the general public attend if they want, they typically don't. So depending on who's looking at it, they're saying that's a special needs program. It doesn't meet the community settings rule, and therefore you have to use flex funding. Or my son, for example, does therapeutic horsemanship, which is at a stable that focuses and does that, exclusively. It's not in a integrated setting where people out there riding their own horses and whatnot. So that has to be pushed down to flex funding and can't be used for individual goods and services. So anything you can do in 5728, you can also do in 5300. So I could pay the YMCA membership out of 5300, but the integration initiative program that's not terribly integrated, or the therapeutic horsemanship, I have to pay out of 5300. It cannot be paid out of 5728. So that's another kind of nuance in this whole thing. I am going to move on to the next slide unless there's burning questions. And this one, Diane, I think is you.
Thanks, Ed. And so, MA 21 call to action, we've mentioned a few times now about the website, and we also encourage everyone to get to know your legislators, share your stories. It's a way to build relationships, and of course, thank our legislators. We ask that you register for future MA 21 meetings, and that you can do from the website. We encourage you to attend the SDAB meetings on the website, the SDAB webpage. They have listed the upcoming meeting dates. The next one is June 5th. We do know that the meetings are in person. However, the venue is there's limited space. So you would benefit from attending by virtually.
Although you probably can hear the conversation better in the hall up there than you can on the phone, or could this past month.
Okay,
There's
thanks.
trade-offs. Hopefully they'll improve the remote participant experience next time.
And then, and Ed had mentioned about the SDAB working group, so that subcommittee's meeting is on, April 10th. And, Robert had, again, Robert had mentioned when he talked about the proposed regulations, look out for that second public comment period. If you're on our email distribution list, we would definitely share that information once we receive it.
Relative to SDAB and whatnot, two things, I guess. One is there's value in listening to those conversations and hearing what's going on, but there's also huge value in DDS seeing people showing up and caring and listening. You won't get to talk other than if you can get something in their 2-minute public comment period, but it's worth going and it's important.
And our next meeting is Tuesday, May 21st. Again, sign up, register from our website. And I mentioned the updates. And I would always appreciate feedback on today's meeting. And you can send it to the email ma21@arcmass.org. So right now we're going to stop the recording